7 Diabetes Emergency Signs You Can't Afford to Ignore. Could you be ignoring life-threatening signs of a diabetes emergency? Sometimes your body gives you subtle warnings that things are spiraling out of control. Are you paying attention? Do you know how to recognize when your blood sugar levels could send you straight to the ER? Don't worry, you're not alone. In this video, we're uncovering 7 critical diabetes emergency signs that you can't afford to ignore, and we'll show you exactly how to act fast to protect your health. Diabetes is a condition that requires constant attention, but did you know that missing just one critical sign could lead to a life-threatening emergency? Recognizing the early warning signs of a diabetes crisis can make the difference between quick recovery and serious complications. Unfortunately, many people don't realize they're in danger until it's too late. In this video, we're going to share 7 emergency signs that every diabetic and their loved ones need to know. From symptoms that seem minor to the ones you absolutely can't ignore, these insights could save lives. Stay tuned, because knowing these signs and how to respond can be the key to protecting your health. Sign number 1. Severe hypoglycemia. Severe hypoglycemia occurs when blood sugar levels drop to dangerously low levels, typically below 70 milligrams per deciliter. This condition can quickly spiral into a life-threatening emergency if not addressed promptly. It often results from skipping meals, taking too much insulin or diabetes medication, or engaging in intense physical activity without proper fueling. Symptoms can range from mild to severe, starting with trembling, sweating, dizziness, hunger, and irritability. If left untreated, it can escalate to confusion, slurred speech, blurred vision, difficulty concentrating, seizures, and even unconsciousness. In extreme cases, severe hypoglycemia can lead to a diabetic coma or death. When hypoglycemia strikes, acting fast is critical. The first step is to consume fast-acting glucose sources, such as fruit juice, regular soda, glucose tablets, or candy. A general rule is to aim for 15 grams of fast-acting carbohydrates, then wait 15 minutes before rechecking blood sugar levels. If levels remain low, repeat the process. However, if symptoms worsen or the individual loses consciousness, emergency medical attention is essential. Caregivers should administer a glucagon injection if available, as it can quickly raise blood sugar levels and stabilize the individual until professional help arrives. Preventing severe hypoglycemia is just as important as treating it. People with diabetes should monitor their blood sugar levels regularly, especially before and after meals, exercise, or periods of medication adjustment. Eating balanced meals and snacks, avoiding excessive insulin doses, and maintaining consistent daily routines can also help reduce the risk. Additionally, carrying quick sources of glucose and wearing a medical alert bracelet can provide an added layer of protection. Severe hypoglycemia is a serious but manageable condition if you recognize the warning signs and act quickly to address them. Sign number 2. Diabetic ketoacidosis. Diabetic ketoacidosis, or DKA, is a serious and potentially life-threatening complication of diabetes that requires immediate attention. It occurs when the body cannot access glucose for energy due to insufficient insulin levels, forcing it to break down fat instead. This process produces ketones, acidic byproducts that build up in the bloodstream, leading to toxicity. DKA is more common in individuals with type 1 diabetes, but can also occur in those with type 2 diabetes under certain conditions, such as severe illness, infection, or missed insulin doses. Recognizing the symptoms of DKA is critical for timely intervention. Common warning signs include a fruity or acetone-like odor on the breath caused by ketone accumulation, extreme thirst that doesn't seem to be quenched, and frequent urination as the body attempts to flush out excess sugar and ketones. Additional symptoms include nausea, vomiting, abdominal pain, rapid breathing, fatigue, and confusion. In severe cases, DKA can lead to a diabetic coma or death if not addressed quickly. If you or someone you know is experiencing these symptoms, immediate medical care is essential. DKA cannot be treated at home and requires hospitalization. At the hospital, doctors will typically administer intravenous fluids to rehydrate the body, insulin to bring blood sugar levels back to normal, and electrolytes to restore balance. Delaying treatment can lead to severe complications such as kidney failure, swelling in the brain, or even cardiovascular collapse. Preventing DKA starts with proactive diabetes management. Regularly monitoring blood sugar levels, taking insulin as prescribed, and being extra cautious during periods of illness or stress can significantly reduce the risk. If you notice elevated blood sugar levels along with ketones in your urine, which can be tested using over-the-counter ketone strips, consult your healthcare provider immediately. Early action and awareness of DKA symptoms can save lives and prevent dangerous complications. Sign number 3. Hyperosmolar hyperglycemic state. Hyperosmolar hyperglycemic state is another potentially life-threatening emergency that can occur in people with diabetes, particularly those with type 2 diabetes. Unlike diabetic ketoacidosis, HHS is characterized by extremely high blood sugar levels without the production of ketones. This condition often arises when blood sugar levels become dangerously elevated, often above 600 milligrams per deciliter, leading to severe dehydration and increased blood thickness, hyperosmolarity. The body's inability to properly hydrate the tissues causes a range of symptoms that require immediate medical attention. Symptoms of HHS can develop gradually over days or weeks, making it harder to recognize early on. The first signs often include extreme thirst and dry mouth, as the body tries to compensate for the loss of fluids due to excessive urination. As the condition worsens, you may notice blurred vision, weakness, and fatigue. Confusion or disorientation is another red flag, and in severe cases, HHS can progress to a diabetic coma, which can be fatal if not treated promptly. If you or someone you know shows signs of HHS, it's critical to take action right away. The first step is to call 911 or seek immediate medical help. Medical professionals will typically begin by rehydrating the patient with 4 fluids to restore the body's fluid balance. Once stabilized, insulin will be administered to bring down blood sugar levels. It's important to note that HHS can develop more slowly than DKA, which makes it easy to underestimate the severity of the situation. To prevent HHS, it's essential to regularly monitor blood sugar levels, stay hydrated, and adjust insulin doses as needed. It's also important to be vigilant during times of illness, stress, or dehydration, as these conditions can increase the risk of HHS. Be sure to stay on top of any prescribed medications and seek immediate help if you notice the signs of dehydration or confusion. Early recognition and prompt treatment are key to preventing life-threatening consequences from this condition. Sign number 4. Chest pain or shortness of breath. For people with diabetes, the risk of cardiovascular issues is significantly higher, including heart attacks and strokes. This makes it crucial to recognize the signs of chest pain or shortness of breath, as they could be early indicators of a heart-related emergency. High blood sugar levels, poor circulation, and the long-term effects of diabetes on the blood vessels and heart all contribute to the increased risk of these conditions. If you experience chest tightness, pain that radiates to your left arm or jaw, or shortness of breath, these are symptoms that should never be ignored. While chest pain can sometimes be associated with a less serious condition, it can also be a sign of a heart attack or angina, reduced blood flow to the heart. Shortness of breath, on the other hand, may indicate that your heart is struggling to pump blood efficiently, which can be life-threatening if not addressed immediately. It's important to remember that people with diabetes are more likely to have atypical heart attack symptoms, meaning the pain may not always feel sharp or localized in the chest. For some, the sensation might feel more like discomfort, pressure, or a squeezing sensation rather than outright pain. Additionally, the symptoms might come with sweating, nausea, dizziness, or a sense of impending doom. If you experience any of these signs, it's critical to act quickly. Call 911 or seek emergency medical care immediately. Time is of the essence when it comes to heart attacks and strokes, and the sooner you receive treatment, the better your chances of recovery. Medical professionals will assess the situation and may perform tests such as an EKG, blood tests, or imaging to determine if you're having a heart attack or if other issues are present. To reduce your risk of heart-related emergencies, it's essential to maintain healthy blood sugar levels, monitor blood pressure, and follow a heart-healthy diet rich in fruits, vegetables, and healthy fats. Regular physical activity is also crucial for strengthening the heart and improving circulation. If you're already experiencing chest pain or difficulty breathing, don't wait. Seek medical help immediately to avoid severe complications. Sign number 5. Sudden vision loss. Vision problems can be a major concern for people with diabetes, as high blood sugar levels over time can lead to serious complications such as diabetic retinopathy, macular edema, or even glaucoma. When blood sugar levels are poorly managed, it can damage the blood vessels in the eyes, affecting the retina and leading to vision problems. Sudden vision loss or any significant changes in vision should never be ignored, as they could indicate a critical issue that needs immediate attention. Symptoms to watch for include blurred or distorted vision, the appearance of black spots or floaters in your field of view, or sudden partial or complete blindness. These changes could occur in one or both eyes and might happen gradually or suddenly. In some cases, individuals with diabetes may experience flashes of light, an increase in the number of floaters, or dark shadows obstructing their vision. These signs could point to retinal damage caused by diabetic retinopathy, where the blood vessels in the back of the eye leak or become blocked. Another potential cause of sudden vision loss is high blood pressure, which is common among those with diabetes. When blood pressure levels rise, they can damage the small blood vessels in the eyes, contributing to vision issues. Additionally, issues with blood vessels, such as bleeding in the retina or fluid buildup in the macula, may result in rapid or gradual vision changes. If you experience sudden vision loss, it's essential to seek urgent medical care. The longer the condition goes untreated, the higher the risk of permanent damage. Visit an eye specialist, ophthalmologist, or go to the emergency room right away, especially if your symptoms are accompanied by other warning signs like headache, dizziness, or pain. Treatment for diabetic retinopathy and other diabetic eye conditions can prevent further damage, but it often needs to be addressed promptly to prevent long-term vision impairment. In addition to seeking medical care, managing blood sugar levels, blood pressure, and cholesterol are key factors in preventing eye-related emergencies. Regular eye exams are crucial for early detection of any issues that could lead to vision loss. And if you notice any changes in your vision, don't delay in getting help. Your eyesight is precious, and taking care of your eyes can make all the difference in maintaining your quality of life. Sign number 6. Severe foot infections or ulcers. Foot infections and ulcers are common but serious complications for people with diabetes, especially when blood sugar levels are poorly controlled. High blood sugar can impair circulation and damage nerves in the feet, leading to poor healing, reduced sensation, and an increased risk of infections. These infections, if left untreated, can quickly escalate and result in severe complications like gangrene or even amputation. It's essential to recognize the warning signs early and take swift action to prevent permanent damage. Symptoms to watch for include redness, swelling, or tenderness around a wound or ulcer on the feet. In more advanced stages, you might notice pus or drainage coming from the wound, or the skin may appear blackened or discolored, indicating tissue death, gangrene. If you experience any of these symptoms, do not wait for them to get better on their own. Seek medical help immediately. Infections in the feet can spread rapidly, and if they aren't treated properly, they can lead to more severe conditions like sepsis, a life-threatening infection. Action steps are critical when you notice signs of a foot infection. First, make sure to clean any cuts or wounds on your feet immediately with mild soap and water, and keep the area covered with a clean bandage. Avoid walking on an infected foot to prevent further irritation or injury. However, the most important step is to seek medical attention promptly. A healthcare professional can properly clean the wound, prescribe antibiotics, and monitor for any signs of infection spreading. In some cases, more advanced treatments like debridement, removal of dead tissue, or even surgery may be necessary to prevent the infection from worsening. Prevention is key when it comes to foot health for diabetics. Regular foot care, including washing your feet daily, keeping them dry, and inspecting them for cuts, blisters, or signs of infection is crucial. Additionally, wearing comfortable shoes that don't cause blisters or pressure points is essential for protecting your feet. Regular checkups with a podiatrist can also help catch potential issues early before they escalate into emergencies. Remember, severe foot infections or ulcers can be life-threatening, and diabetes puts you at higher risk for complications. Early intervention is the best way to prevent serious consequences like gangrene or amputation. If you notice any unusual changes in your feet, seek help immediately. Your health and mobility depend on it. Sign number 7. Persistent vomiting or diarrhea. Persistent vomiting or diarrhea can be dangerous for people with diabetes because it can lead to dehydration and severe electrolyte imbalances. When your body loses fluids and essential minerals through vomiting or diarrhea, it can cause your blood sugar levels to fluctuate, making diabetes management more challenging. This is particularly concerning if the symptoms persist for an extended period, as it can lead to diabetic ketoacidosis, DKA, or hyperosmolar hyperglycemic state, HHS, both of which are life-threatening emergencies. Symptoms to watch for include an inability to keep food down, severe dehydration, dry mouth, dizziness, and reduced urination, and extreme weakness or fatigue. You may also notice that your blood sugar levels are harder to control, either rising or dropping significantly, which can lead to additional complications. If vomiting or diarrhea continues for more than a day, you should seek medical attention immediately. Prolonged dehydration can cause your body to go into shock, and in some cases, it can lead to kidney damage or failure. Action steps are critical when you experience persistent vomiting or diarrhea. The first thing you should do is try to stay hydrated by sipping small amounts of water or an electrolyte solution, as dehydration can rapidly worsen the situation. Avoid sugary drinks or alcohol, which can aggravate dehydration. Additionally, make sure to monitor your blood sugar levels frequently during this time, as both vomiting and diarrhea can cause rapid changes in your glucose levels. If you are unable to control your blood sugar, or if your symptoms worsen, don't hesitate to seek medical care. A healthcare provider can administer fluids intravenously to rehydrate you and help restore your electrolytes to normal levels. Preventing dehydration during illness is essential for diabetes management. If you are experiencing stomach issues, try to rest and avoid heavy meals. If vomiting or diarrhea persists, consider visiting your doctor or going to the emergency room, as they can't provide the appropriate treatment to stabilize your condition and prevent complications. Remember, persistent vomiting or diarrhea isn't something to ignore. It can be a serious emergency, especially for diabetics. Taking swift action and seeking medical help early is key to avoiding dangerous complications and getting back to feeling better faster. Key takeaways: recognizing and preventing diabetes emergencies. Diabetes emergencies can escalate quickly, but recognizing the warning signs and acting promptly can save lives. Let's recap the 7 critical signs you need to watch for. Severe hypoglycemia with symptoms like dizziness or unconsciousness, diabetic ketoacidosis, DK, signal by fruity breath and nausea, hyperosmolar hyperglycemic state, HHS, characterized by extreme thirst and confusion, chest pain or shortness of breath that could indicate a heart attack, sudden vision loss hinting at retinal damage, severe foot infections or ulcers, and persistent vomiting or diarrhea leading to dehydration. Each of these signs is your body's way of signaling that it needs immediate help. Ignoring them can lead to serious complications or even life-threatening outcomes. That's why it's crucial to have a diabetes action plan in place. This means knowing how to monitor your blood sugar regularly, being aware of what's normal for you, and understanding when to take immediate action or seek professional help. Keep tools like a glucose meter, ketone strips, and fast-acting glucose on hand, and always have emergency contact information readily available. Education is another powerful tool in preventing emergencies. The more you know about your condition and the factors that can trigger these signs, the better prepared you'll be to manage them. Share this information with your loved ones as well. They can be vital in helping you respond quickly during an emergency. Remember, preparedness and awareness are your strongest defenses against diabetes emergencies. By acting swiftly, staying informed, and keeping a close eye on your health, you can avoid potentially dangerous situations and maintain a safer, healthier life. Always prioritize your well-being, and don't hesitate to reach out for help when you need it. Your health is in your hands. Don't ignore these warning signs that could save your life. Recognizing these diabetes emergencies and acting quickly can make all the difference. Remember, staying informed and prepared is your strongest line of defense. Now, let us hear from you. Which of these signs surprised you the most? Have you experienced any of them before? Share your thoughts and experiences in the comments below. If you found this video helpful, don't forget to give it a thumbs up, share it with others who might benefit, and hit that subscribe button for more essential tips on managing diabetes and living a healthier life. Take care, and we'll see you in the next video.